Hi, my name is Karis, and I'm a level 1 nursing student. My clinical instructor has assigned me to um, observe you today. S-
Excellent. Feel free to ask me any questions you may have.
Thank you so much. I look forward to learning a lot. So, you're taking care of the patient in room 529. Do you have time to give me a report?
Sure. I'll give you a report in our typical SBAR fashion. So the patient in 529, her chief complaint, she was admitted from direct admit from the doctor's office for a non-healing sacrum wound ulcer. It's stage 3, full thickness. It measures 4 by 1 centimeters, and the skin around it is slightly reddened. She's an 80-year-old female. She's 5'5", 175 pounds. Her level of orientation is alert and aware times 3. She has been cooperative but a little bit anxious. Her Perla, she's Perla, and she has a 2 millimeter pupil. She is able to move all extremities. She does have some pain at a level of 6 on a pain scale of 1 to 10. However, she states that that's an acceptable pain level, and she does not want to use any of the pain medications, so we will just continue to try to make her as comfortable as possible with non-pharmacological therapy. And then the assessment part of our SBAR is some of her vitals. Her lungs are good. She has slightly diminished a non-productive cough. Her heart rate is 88 beats per minute with a S1, S2 normal rhythm, no murmurs or gallops. She is on an MPO diet, and she does have an IV on her right hand, her right dorsal hand. The doctor has recommended that we clean her wound with a normal saline and then dress it with hydrochloride dressing. And she is scheduled tomorrow for surgery for irrigation and debridement of that sacral wound, which is why she's on the NPO diet. She does have some medications that we're going to administer today. The gentamicin, 4 milligrams, IV piggyback. And then she is also going to have IV fluids of normal saline with potassium chloride running at a rate of 125 milliliters per hour.
Awesome. Thank you so much for giving me a report. Do you mind if I ask you a few questions regarding the medication administration and then watch you administer the patient?
Sure, not a problem at all.
Thank you so much. Well, why specifically is this client receiving this medication? What action does it have on the body?
This patient is receiving gentamicin for the sacral wound that she has. And the action that it has on the body is it's a broad spectrum antibiotic that's going to help specifically for bone and tissue healing.
Okay. When should you question administering this medication?
I would question administering this medication when the patient has any known allergies to any of the aminoglycosides.
Okay. Does the patient have a therapeutic serum level?
This medication does not have a therapeutic serum level because it's not based in that category. It's off of the patient's weight.
Okay. And what vital signs would you monitor when you administer the medication?
The vital signs that I would watch would be typical respiration, blood pressure, heart rate, temperature, uritis or pruritus.
Okay. And then would the physiological parameters that you'd monitor be like that?
Yeah, they're pretty much the same as
Okay.
the vital signs.
What interventions would you teach a client to ensure that the medication is administered safely in the hospital setting and at home?
Well, in the hospital setting, you always want to notate to the patient that she does have the right to refuse to take this medication if she does not feel like it's appropriate for her, or she has any questions prior to administration. And then, as well as if she does agree to it, you want to make sure that she takes the dose fully, so that way that the bacteria does not create a super infection and create a resistance to it. And then in the hospital setting, you also want to make sure that you do your 5 rights, so the right route, the right dose, the right amount, right time, right doctor, right patient, and that your patient is aware of all of these things as well as signs and symptoms of adverse reactions.
Okay. Thank you. What are the side effects and potential adverse reactions?
The typical side effects for this medication are generally mild, but rash, nausea, vomiting, fatigue are the most common.
Okay. And how would you know the medication was effective?
You would know the medication is effective because of the fact that this is a bacterial side that causes premature termination of the growing polypeptide chains. So, that being said, you want to check your lab values to make sure that the white blood cells are going down and that you're actually seeing progression of it getting better.
Okay. Um,
Do you have any more questions for me before I go and administer the medication?
no, thank you so much for answering all my questions.
Okay, great. It's important to know your patient and the medications you're about to administer to keep your patient safe. Okay, Karis, would you like to watch me administer a safe medication?
Yes.
Okay, great. So the first thing we're going to do is we are going to administer our sodium chloride with our potassium um, infused in there through our Laris pump. And so the very first thing we do is we're going to ask our patient their name and date of birth. And ma'am, can you tell me your name and date of birth? Great, thank you. And since they verified that, then we go over here and on our plow for the med administration, we are going to verify the correct medication. And you see we come up green, so we have verified with the patient, we've done our 5 rights of the right route, the right time, the right patient, the right documentation, the right order, and the right amount. So we're going to take our bag of 0% sodium chloride with 20 MEQs of potassium chloride, expiration date of 7/17. The integrity of the bag is good, and there's no punctures or holes. And you want to lay it down on the table when you're going to spike the bag. I'm washing my hands, and you want to make sure you keep the tip of your spike completely clean as well as the tip of the bag. I'm going to come over here and hand it up and turn on our pump. And so we're channel select. And we want to use the IV fluid guardrails. You always want to use the guardrails. And then we come into the selection portion and we're going to find our drug, which is normal saline with KCl 20 MEQs. So we're going to press that button. And it's asking you to confirm it. Yes. And you're going to insert the amount. Sometimes the amounts are preset in there for you, depending on what floor and what Alaris pump that you might have. So sometimes you can do a little less work. And it's 1,000 milliliters. And it's telling me to check the line because I have not inserted the line in there. So you want to make sure your line is clear of all air bubbles. And it's the blue side in.
Good to know.
Just like a cassette. You're going to close it. And if there's any resistance, you don't proceed. You check the line and see what's going on before doing that. You don't want to harm the pump. And this is roller clamped. So we want to make sure we unroller clamp it and allow 2 drips to hang before leaving the patient. I'm just going to hook up the IV. And it says there's air in the line, so we're going to pause the alarm and pull it out. And try your best to get all the air bubbles out of the line. Let's see if it likes it now.
Thanks.
And we're good, green to go.
Wonderful.
Thanks.
Sorry.
Okay. Okay, Karis, now if you'd like to watch me, I'm going to go ahead and administer a secondary line on our Alaris pump for the IV piggyback of the gentamicin that our patient has ordered. We're going to go ahead and kind of do the same steps over again, even though it seems silly. We just want to verify their name and date of birth as well as allergies.
Okay.
So we're going to ask our patient the name and date of birth again. And thank you very much. She's verified the name and date of birth and no allergies. And then we come over here to our MAR and we're going to go ahead and scan our medication. And you could...
And it's beeping again. And I pause it right inside.
And you want to make sure that it comes up green, so it's the correct medication, as well as we did our checks, the right time, the right route, the right dose, the right patient, and the right amount. So what we're going to do now is grab our supplies that we've prepared already. And you want to make sure that, again, that your medication is the right medication, the right amount, the expiration date, and the integrity of the bag is good, that the two pieces are sterile, since this is the sterile portion when you insert it. And every piggyback comes with one of these little clips, and when the piggyback is going, you want to make sure that the primary medication is running in first, so that way. And again, you're priming the line, and you're going to do a little backfill if you need to. And then you come over to your pump, and you're going to click on the channel select, and it's going to ask you here secondary line, and then we're just going to find our medication just like we did before by pushing the page up or page down. Here it is, the gentamicin, once daily, yes, 4 milligrams, and 50, and patient's weight of 71. And then next, it's asking you to confirm it and that the guardrails are correct. And since there's not a blue cap on here, you're just going to scrub the hub. So I'm going to grab my alcohol pad and I'm going to scrub it for 15 to 20 seconds. And then you're going to come above the brain of the Alaris pump. And you don't really need to scrub this one, but since you have the alcohol in your hand, you might as well do it. And you
Wasn't it like 1500?
add the 2. Unclamp this one, and again allow 2 drops to drop before you leave the room, and make sure that the pump is running correctly. And you can see we have the green light still, so we're good to go.
Wonderful.
Great.
Thank you so much for demonstrating a safe medication administration. I just have a couple of questions, if you don't mind.
Sure.
Okay. Were there any pertinent pieces of information that you reviewed before administering the client the medication?
Well, as you know, the pertinent pieces would be to the correct patient, our 5 rights, the allergies, the doctor's orders, and you want to compare that against the MAR as well as your patient's armband, and ask them again if they have any allergies.
Okay. And did the information affect your decision to administer the medication?
Nope, because all our information was correct via the patient and our MAR, our doctor's orders.
Did this information affect how you administered the medication?
No, because we just follow the doctor's orders.
Okay. Thank you so much for answering all my questions. I really feel like I understand it a lot better now.
Great, not a problem. If you have anything else, I'll be free to answer that. I'm going to go over here and document some information on the teaching that I provided to the patient, as well as the administration that we did, if you'd like to come and watch.
I'd love to.
Great, thanks.
Thank you.